Hi, everyone. I'm Dr. Linda Mattioli, and I help teach the practice management part of the Origins Incubator course. And today I'd like to discuss how I recommend moving through the initial appointment, which we call the foundational assessment, which is where we discuss initial foundational blood work and how we use that appointment to educate the patient on how we might peel back the layers of the onion in terms of their health and how we use that information to recommend either further testing or treatment options and how that might look in the context of a year-long membership program. So in case you're new to what we teach at the incubator, is we teach a flow of appointments that have been really helpful for me and my practice for the past 8 years or so, where we do a discovery call followed by a foundational assessment, which is a one-time assessment, and then a year-long membership. So today I'm going to focus on that foundational assessment appointment and how somebody coming in with, or actually we're going to compare two different patients with two different presenting issues and how we might work through those recommendations and what that might look like. The reason this is important is because with an integrative or functional approach, it is not cookie cutter, it is anything but. So we're not putting every single patient on the same sequence of testing and interventions. It's very much individualized. You're very much assessing and tailoring all your recommendations depending on how the person is presenting, what they're capable of, what their resources are, things like that. So today I'm going to focus on a hormone patient and a gut-based approach. So for patient number one, for this case study, let's say this is a 46-year-old female who is presenting with brain fog, insomnia, some anxiety, lack of energy. Her menses might be heavy, somewhat irregular, and her main, her dream outcome, so to speak, is that she wants to feel energized and basically like herself in her own skin. She wants to have good sleep and feel energized throughout the day. So my initial approach for this patient would be the labs that I would draw initially would be a combination of not only your foundational markers, along with vitamin and minerals and things like that. But I would also be checking the blood work for thyroid, estrogen, progesterone, testosterone, kind of get an idea of what the hormones are doing at that point. So for the foundational assessment, I do recommend getting labs prior to the appointment and reviewing the labs at that appointment so you get that nice objective and subjective things to assess during that time, so you can make accurate recommendations from there. So when you are discussing, it's important to be able to, into practice, when you make recommendations, to have them relate to what is occurring for that patient. So this is a patient that needs hormone stabilization. They need precursors to make those hormones, and they really need to be educated on the importance of that nervous system health. So with the foundational assessment, my recommendations typically revolve around targeting anything in particular that I see in the labs in terms of replacing vitamin D or B12 or iron or things like that, but also moving through the foundations of lifestyle. So nutrition, stress, sleep, exercise are the main four ones, in addition to the recommendations based on the labs. So what I mean is, in the background of my mind, I know that this person needs that hormone stabilization. So as I am going through the lifestyle recommendations, let's take nutrition, for instance. I might discuss how the HPA axis, so how our hormones interact with our adrenals, along with insulin and thyroid and our sex hormones as a foundation to discuss, in order to stabilize your insulin throughout the day, which therefore helps stabilize our cortisol levels and our thyroid and our sex hormones. We need to make sure that we are not only not snacking all day, but also not having periods of prolonged fasting, which would make our blood sugar dip and then our cortisol respond to that. So my nutrition recommendations would be based on a low inflammatory diet, along with eating regular meals throughout the day at certain times to kind of help stabilize those adrenals and stabilize that insulin. Now, we almost always get a question about intermittent fasting, and that is a separate topic, but a short response would be, I initially make sure that our adrenals aren't overly taxed and that the body can handle intermittent fasting before recommending that. So I almost always recommend that stabilization of blood sugar initially. So with every foundational recommendation, we are making recommendations within the backdrop of their chief complaint of what they're here for. So then moving on to movement or exercise, after you kind of realize what they're doing. So say this person is does a lot of HIIT workouts and is a marathon runner, just really kind of pushing their body, then I will take that opportunity to discuss the interactions of our nervous system and cortisol levels and how that impacts progesterone levels and things like that. So my recommendations for exercise at that point would be more related to more rejuvenating breath work like yoga, Pilates, Tai Chi, not saying to completely disregard their current workout schedule, because a lot of times that's very therapeutic for them, but starting to kind of, introduce some of these other exercise techniques that can really support that parasympathetic nervous system, so that those cortisol levels can drop and things like progesterone can rise, which will in turn help with sleep and help with anxiety and help with things like that. So as you can see, the recommendations are always kind of intertwined with their complaint. And so when we're talking about advanced testing, so at the end of every appointment, I take a moment and kind of recap, based on your labs, which show, so for instance, maybe this person is a little bit iron deficient, vitamin D deficient, B12 deficient. Maybe their progesterone is a little bit lower compared to the estrogen. So I do that estrogen progesterone ratio, and I see that they're a little bit estrogen dominant. That might be like the typical labs that I might see for a woman who's presenting like this. So I would initially recommend, let's initially get these nutrients replaced with vitamin D, B12, iron. Might put her on a good B complex to help with that adrenal support, along with vitamin C, which can also help support progesterone levels. And then working on those lifestyle foundations to just start to create that signal of safety to the body. So the body is starting to feel now that, okay, my blood sugar is stable throughout the day. I'm not doing as strenuous of workouts as frequently. So that piece can kind of calm down. So the body has the precursors with the supplements to make the hormones. The nervous system is starting to calm down. And then if it's purely a hormone approach, at that point, I would say, in order to further investigate and heal on a deeper level, I would love to see a 4-point cortisol curve. If that person is estrogen dominant on the blood work, then I might opt for a test such as the Dutch test, where I can see more about their estrogen metabolism. So then my offering to them would be work on these foundational supplements and this foundational lifestyle approach. But then I would love to get this 4-point cortisol, as well as more information about how you're metabolizing your hormones, so we can better support you in that way. So they would be able to do those advanced testing prior to our next appointment. Now, if somebody came in, say this is a 28-year-old with just a lot of bloating, they might alternate between constipation and diarrhea. And that is kind of their main complaint, is they have low energy. They just have a lot of GI symptoms, more of like an IBS, kind of presentation. So when I'm looking at their foundational labs, and I may not do, probably wouldn't do hormones for that person. I'm just doing, again, like their vitamins and their minerals and, those foundational labs. Then in what I'm really focused on during the foundational assessment, after I do their history and their physical and things like that, is really educating them about gut permeability and the things that we know for certain really impact our gut health, such as our food, any medications, stress, and then, of course, any dysbiosis like bacterial overgrowth or yeast overgrowth. All these things can create an inflamed gut, things like that. So I take those, I use that opportunity to take that foundation for gut healing and kind of move through the process. So for nutrition, I would recommend a low inflammatory diet, really focusing on foods that are easy to digest. I might really focus on, in terms of the stress part of my intervention or my plan, really talk about the parasympathetic nervous system and how that it's so important to support that for our rest and digest systems. So everything from the environment you're eating, how you're chewing, impacts your digestive enzymes and the ability for you to digest well. So just educating them on that process, and really encouraging some meditative time and things like that to really upregulate that parasympathetic piece of it. Also, I might recommend some really good core yoga support that really just helps with the lymphatics and the blood flow to that, to the gut area for them. Now, in terms of lab review, I'm looking at vitamin and mineral deficiencies to see what their absorption status might be like. So my treatment plan from a supplement standpoint would be, replacement of those nutrients. If indicated, any sort of like digestive support, some herbs or bitters to just help kind of calm that stomach. If they're more diarrhea dominant, might be a prebiotic to kind of help support that. But then at the end of that appointment, as I'm kind of recapping everything, we can say, we're starting to treat these symptoms by, removing inflammatory foods and working on when and how we eat. Also working on really upregulating our parasympathetic nervous system, so your body can feel rested enough in order to digest appropriately. Replacing any deficiencies or anything that we're seeing on the labs. Of course, looking for like liver enzymes and kidney health, making sure that all looks okay, and inflammatory markers, things like that. But then my deeper dive would be more gut centric. So in order to really investigate your, how you're digesting, and to investigate for any dysbiosis in the gut, which is, any bacterial or yeast overgrowth, I would recommend a stool analysis. I might recommend a SIBO breath test or an OAT test in conjunction to really get a full picture, but really explaining it so they understand that it's a stepwise process. And for them, that would be our next step. So then they would be implementing these foundational pieces while they're getting this advanced testing done. And then at our next appointment, we will be seeing kind of what was working for them, what wasn't working for them with our previous plan, because I always tell people, like, it's, at every appointment, depending on your life and what you're going through, we might need to adjust some things. And this is just, we're partnering together in this process. But then at that appointment, we can adjust as needed, review the advanced labs, and then move on from there. It really works beautifully in the context of a membership because they have this safe containment where they can, we can kind of work through it in a bit of a cadence. And as the provider, as a physician, you're having follow-up. You're not worried about, reviewing a stool analysis with somebody and then them not following up for 6 or 9 months. And then when they do, you kind of are starting from scratch again. So within this process, I will kind of go through and, teach you how we do all of this. But that is how I would walk through the different approaches for more of a hormone-centric patient and then a gut-centric patient. So I hope that was helpful for you. And we will see you next week. Thanks a lot.